Good morning, friends. Myself, Dr. Atul. I'm your faculty for prevention and rehabilitation. Today we are going to discuss about the sports injuries. Till now, we have discussed the types of injuries like acute and overuse injuries, and what are the common acute and chronic or the overuse injuries, and why we call them the sports injuries, because they are overuse injuries are quite common in the sportsmen rather than the persons, those who are not doing regular exercise. And while the acute injuries keep occurring in the normal population also and the sportsmen also, but the mode of injury is little bit different. In the normal population, acute injuries occur due to some accident, while in the sportsmen they occurred because of faulty techniques or some excessive trauma to that body part. So acute injuries generally occurs as a common single episode, and overuse injuries are the collection of micro injuries and that convert into the overuse injuries like tendinopathy, stress reactions, synovitis, or callus formations. While the acute injuries are single episode, like a sportsman has to start his sprint, 100-meter sprint, and all of a sudden his hamstring got pulled or hamstring spasm. So it's a example of acute injuries. Like a football player, he suddenly twisted his knee and he ruptured his ACL, or a ball hit on his he twisted, or he just on the badminton court, and he twisted his ankle and injured his deltoid ligament. So all these injuries are acute injuries. And while the overuse injuries, when the microtrauma increases the healing of or repair part, so these injuries occur. So the examples of acute injuries are fracture, periosteal contusion, dislocation, subluxation, tear, strain, tear, contusion, lacerations, abrasions. And overuse is stress injuries, periostitis, apophysitis, osteophytes, synovitis, osteoarthritis, stability, tendinopathies, DOMS, callus, etc. So these injuries are because of overuse. And what are the prevention how you can prevent these injuries are by follow the rules, do proper warm-up, wear protective gears, respect your fellow player, timely replace your gears, shoes, and include plyometric and proprioceptive exercise during your training schedules, maintain proper hydration, maintain proper nutrition, play intelligently. That is, before competition, your training should be like that, so you can save yourself for the competition. Do relaxation exercises and plan your activities in advance. Like if you are a boxer and you are fully aware and about your fellow boxer, and you have seen so many other bouts of him, so you can plan in advance how is his move, or so that is one part. Second part, when you are going to play abroad or some different time zone, if you are planning yourself or you plan your activity in such a manner, so at the D-Day you're not exhausted, there is no jet lag, and you are properly well acclimatized for that time zone, or well hydrated and well nutrition, then the chances of injuries will be very less. So all these things you have to plan, or you will plan for your athlete. So now we are going to study the initial management. So you might have heard, or you all have heard about the various protocols. Some say कि put warm, or some say कि massage, or some say कि put something or something else. This is Ayurvedic medicine, it will not hurt. So I'm not saying Ayurvedic medicines are not good, but initially what you have to do is give rest to your body part as per initial dictum. Apply ice so the swelling or the inflammation doesn't increase. Then give a compression and elevate that injured part, so the blood flow will not the loss of blood will not increase. So these things you have to keep in mind. So initially you might have heard about the rise, then comes the price means protection, then rest, ice, apply ice, give a compression and elevate the injured part. This principle fits for almost each and every injuries. If the individual suffered from a fracture, then you have to apply ice, give rest to that body part, that is provide a splint, then compress that body part. Compression at the fracture side doesn't require too much, but splint so that fracture bones don't get be displaced, and then elevate so the swelling of that bone or loss of blood will not increase. So then comes the polish, that is protection, optimum loading, icing, compression and elevation. So the basic difference in the rise, price and polish is in the polish there is a optimum loading, that is you don't have to wait till the time the fracture is not healed or the healing part is not completed. As soon as you give a optimum loading where the injured part doesn't get disturbed or doesn't get dislocated, the injured side is not badly affected by this loading, till then you can provide a optimum loading. But it is difficult to judge. For the optimum loading it's required a experienced person, and the result of optimum loading is quite impressive. Like nowadays, as soon as TKR or THR, that is total knee replacement or total hip replacement, very first the orthopedic surgeon or ask them to stand on their feet on very first day and start bearing weight, but they don't allow them to completely flex their knee or flex their hip. So this is one example of optimum loading. So now we will discuss in detail about the overuse injuries, that is quite specific to the sportsman or the person who is doing regular exercises. They are quite common in these peoples, those who are doing repetitive exercise or they are habit of doing exercise regularly, and these exercises are quite common in these populations. So they are stress fractures, tendinopathies, instabilities, delayed onset muscle soreness, callus formation, etc., etc. So first we discuss about stress injuries to the bones. They are quite a huge part of the sports injuries. These injuries occur when balance between the regular micro damage and remodeling disturbs. So micro damage means when you take some activity or you do some activity, some micro trauma occur on the body, but this is not too much that in a single instance a fracture can occur. It's a very minute or very minor trauma, and simultaneously body has a regenerative power or body has a remodeling power where the replenishment or the repair work of that injury is simultaneously going on. When this homeostasis of this repair and injury got disturbed, so these stress reactions or stress injuries occurs, and these have why this occurs because of either intrinsic or extrinsic factor. Intrinsic factors are malalignment of joints, limb length discrepancies, the age of that athlete, sex of the athlete, and the genetic predisposition, that is race of that athlete. And the extrinsic factors are surface on which they are playing, the training load, or the faulty sport care. They are common factors which causes the injuries. uh, I just give an example. A person who is flat feet and running too much, because or that causes stress or his on his tibia, and because of that he suffered the medial tibial stress syndrome. Or a person who is having genu valgus and putting too much pressure, or he's running, a person having an athlete suffering from cubitus, having cubitus valgus of more than 17 or 20 degrees, and practicing too much of overhead weightlifting, he's prone for the elbow pain, or some elbow pain like common extensor tendinitis, or common flexor tendinitis, or oblique trochanteric pain. So these are the examples of malalignment of joints. Limb length discrepancy put the other limb or the low limb on a stress, and it might cause low back ache also, or the any number of type of injuries. Like age, young persons or young athlete are more prone for the injuries. Females are more prone as per their body structure. They are more prone for the injuries. And the extrinsic factors, like if a person who just comes in the field of sports and or running, and he is running on the hard surface all of a sudden and for a quite long distance, so he will be landing in the injury. Training errors, like changing taking too much load too early, that is a part of training error. Faulty sports gear, like wearing tight shoes, or using tennis racket of not your size. You are putting the grip of that tennis racket is quite small, or quite less, or quite large. That also again give you overuse injuries. In these injuries, the modifiable factors are the biomechanical, that we can change with the help of biomechanical assessment. And with these changes, like a person who is having a flat foot, and we put a medial arch after assessing him, so it might prevent the excessive load on the tibial portion of and lower limb musculature, and prevent the stress reactions on the tibia. Training errors, the again modifiable factors. Surface, if the space is available, then so you should start with the soft ground to hard ground. Or if the surface or the space constraints are there, then you start your training load accordingly. So the changes, the injuries can be minimized. Sports gear, you have to change your sports gear time to time, and you use your your rackets or your gloves for the boxing as per your actual size. You have to use your protective gear which fits you snugly, and it is not be loose enough, which can hamper your vision or hamper your performance. So you have to choose your protective gears, your sports gear wisely and perfectly. Then comes the muscle factors. Muscles, here is a modifiable. Why the muscle factor or musculoskeletal factor is most modifiable? If you before starting running or before starting any rigorous activity, if you develop or if you condition your muscles, then chances of chronic injury will be less. If a person who want to start running, before he started running, if he develops stabilize his pelvic muscles, if he balance his periscapular or scapular or shoulder muscles, then he develops his thigh and calf muscles and do proper proprioceptives of the ankle. Then if he start running, the chances of injuries will be very less. Initially he might have problem of delayed onset muscle soreness, but the more troublesome injuries like stress reaction or some sort of tear of the ligaments or tendon can be prevented. So before taking some activity, it is always be better so your muscle strength will be good. If your muscle strength will be good, the chances of injuries will be very less. So muscle factor is muscles strengthening is very much a modifiable factor in the overuse injuries. The other part like energy availability, calcium and vitamin D we will cover in the next session. Thank you.